So, Dr. Nas, what is Invisalign?
Oh, okay. Now, Invisalign is a series of transparent aligners which patients can wear, and they change to a new aligner every 2 weeks, and these aligners actually sequentially shift teeth. So really, it's a kind of brace, and because it's made of plastic, it's very aesthetic and it's not very obvious when patients wear.
Okay. So, what are the added benefits Invisalign can give compared to traditional braces?
Well, there are quite a number. One, like what I mentioned, is not very obvious. Two, patients don't have to come so often for the adjustments. With traditional braces, you have to come every month, whereas with Invisalign, it's once every 2 months. Three is much more comfortable because the thickness of the plastic is about 0.75 millimeters thick. So that's much less than the thickness of a normal brace. And then lastly, Invisalign has got this prediction system, a simulation system where you can actually see what the end result will look like before you even start. So you can see the end result, you can control the end result, you can tell the orthodontist how you would like your teeth to shift or look, and then you adjust it until you're satisfied, and then that's what you get at the end of treatment.
So, for braces, you cannot really decide what's the end product. It will just be a straight teeth.
I mean, you can give your input towards the end of treatment, but you know what the advantage with the Invisalign simulation is that you can try different scenarios. You know, whether you want to extract and see what you look like if you extract, or what you get if you don't extract, and so on and so forth. So it is really an advantage because sometimes with normal braces, let's say you decided to extract already, you can't change your mind halfway.
Also, for Invisalign, you can change your mind.
In the sense, you can see the future, you can see what you're going to get if you extract or you don't extract, and then you can make a decision.
Ulcers and
Okay, now with ulcers, yes, sometimes because when you first put on the braces rub on the lips, so you do get ulcers initially. But with Invisalign, of course, you don't get that.
okay. So, is it true that Invisalign shifters teeth faster than braces?
I have to say, in my opinion, it's not true. I feel that on average it's about the same. Some movements Invisalign does better than normal braces, and some movements normal braces does better. But on average, it's about the same.
Okay. What is the recommended age for people to do Invisalign?
I think that the age is really about the same as normal braces. Nowadays, they have something called Invisalign Teen. So even if you're a young teenager, you can wear braces nowadays, or wear Invisalign nowadays. So it's about the same. So really, once your baby teeth are all gone, anytime from that point, you can already wear Invisalign, which could be as early as 10 years old sometimes.
So, even though if your baby teeth just drop out and just like start to grow, and then like maybe it's not stabilized yet, can they still do Invisalign?
Yes, and in fact, you can do Invisalign when you still have baby teeth. They have a way to shape the plastic, which will allow for the baby tooth to fall out and guide the new permanent tooth into position.
Oh,
Yeah, so
so
they
it's better.
even have that if you want to. Yeah.
Okay. Is it better and less painful to do Invisalign when we are young?
I would say in general, the studies show that Invisalign causes less discomfort compared to normal braces. That's number one. And number two, when you're younger, because the bone is a little bit softer, so in general, there's less pain compared to if you were to do Invisalign as an adult.
But in short, maybe for teens, they will experience lesser pain.
Yes, there's lesser pain with Invisalign compared to normal braces. Of course, normal braces is not that bad, but yes, Invisalign is less.
Okay. What's the average cost?
Of Invisalign?
Yeah.
Well, there's a range, but in Singapore, it's about 7,000 to 10,000, depending on the case.
So can one just do the upper part and then and like not do the lower part?
It is possible, but for me, what I tell my patients is that it's not worth it because Invisalign charges you the same price, whether you do one jaw or two jaws. So I always tell them, you're wearing the aligner, you're going to go through the inconvenience, you might as well do everything correct and perfectly.
Okay, so what's the after treatment, after straightening your teeth?
After your teeth are straightened, you need to wear a retainer. Now the first 6 months, it has to be full-time wear for the retainer. And then after that, you're supposed to wear it at night to maintain.
It's the same as braces as well.
It is. Once you shift teeth around, whichever braces system, Invisalign or Damon or whatever, you have to wear the retainers.
Okay, thank you.
Okay, you're welcome.